Hello, my name is Peter. I became interested in the role of carers because I was a part of the care of my mum and grandma. 1 in 10 of the English population is a carer, and in some groups it's as large as 1 in 5. This is mainly because of the increasing number of elderly people. But unpaid informal UK carers provide the equivalent of £184 billion yearly. That's the equivalent of the entire NHS and social care budget. But despite this, SALT data shows that 70% of carers were given insufficient support. My interest in caring came at the same time as my interest in Brazil's music and culture, which led me to plan to spend most of my time in Brazil during my gap year. This led me down a rabbit hole where I ended up reading a paper by Matthew Harris on integrating public and primary healthcare through community health workers, also known as Agentes Comunitários de Saúde. In the Brazilian model, community health workers are local people who work in groups of 4 to 6 in a health unit with a GP, a nurse, and a nurse auxiliary. Each community health worker is assigned 150 households where each household receives at least 1 visit a month. They look for community and household determinants for individuals and the population's health. They can then develop public action to deal with common issues, as well as get more up-to-date data of the population. And in these visits, they give the community a voice that can be heard in the clinic. Community health workers have a variety of roles in clinical care, such as chronic disease management and triage, in public health, like data collection, and in community empowerment, like education groups. After speaking to Matthew Harris, he kindly introduced me to Connie Jungens, the doctor who got the community health worker model off the ground in London. Luckily for me, she then introduced me to her community health workers. I interviewed them about their work, and I quickly realised that some of their actions went way beyond the job description, like one community health worker who helped a young carer go through the university application process. Those community health workers set up a coffee meeting in the morning where the community could come together and meet. There, 2 mums who were both struggling with autistic children met each other. The coffee meetings allowed them to find each other, and they have supported each other since. Arguably, this kind of support is better than any kind of support a healthcare service can provide, because it not only provides short-term support, it allows the community to come together and form bonds for long-term support. The community is strengthened and the carers feel seen. Luckily for me, Connie Jungens was planning to go to Brazil to see community health workers while I was there. She invited me to a Fio Cruz talk where her and other doctors spoke. After speaking a bit further, we planned to meet in Manaus in the Amazonas, where I also met doctors Alessandro Jatoba and Paulo Rodrigues. There we went around and saw medics who work in the ambulance boat service and also community health workers who work in a GP practice. While my Portuguese wasn't perfect at this point, I understood quickly that some of the places the community health workers have to go to are really dangerous. Many of them have been shot at and many of them have been threatened regularly. But despite this, they work well within the community. Similarly, while speaking to the ambulance boat service, they showed us the journey they make to reach certain communities. Some of the journeys are up to 14 hours depending on the conditions. On top of this, they're at risk of the boat being damaged by large pieces of wood floating from the Amazon rainforest. The waves can be intense, and as it's the rainforest, it can rain a lot. After seeing both teams, I realised how resilient and community-minded the healthcare workers are. Either their attitude came before the model or developed through the model. But either way, they were extremely happy to go the extra mile because they saw how it affected the community. In my opinion, community health workers in the UK could be a valuable resource for carers. Currently, carers can receive help from various sources, like palliative care nurses, district nurses, or a GP, who may or may not be communicating with each other. Community health workers could help provide a more rounded care by allowing the carers to understand the system better and insisting on things such as home-based records, continuity of care, and caring for the whole household instead of just the sick person. In 2024, a study was conducted on the barriers and facilitators to the integration of community health workers in the Bronx. Community health workers reported that accompanying clinicians on patient visits led to greater patient acceptance of referrals, while program staff reported that there was a power dynamic between community health workers and the clinicians that led to the community health workers to find it difficult to advocate for themselves at times. These are challenges that are expected to be seen when implementing a new system that I believe the UK can overcome. Community health workers could support carers and improve team working in the NHS, and so reduce overall costs and improve quality of care and social cohesion. While this may sound difficult, what I saw in Brazil is proof that it is possible. Thank you very much.